Okay, let's just get started. I think if some more people are supposed to be coming in, but we'll start and because we just have an hour together, or now less than an hour, and we have some great guests with us. So welcome to the Jewish Community Foundation Access to Insight series. Today's webinar, we've been doing a whole series on needs in Israel, challenges, opportunities. Today's subject is on mental health in Israel. And we have some great guests with us who I'll introduce in a second. I'm Charlene Seidel. I think I probably know many of the people on the call. I'm the President and Chief Philanthropy Officer of the Jewish Community Foundation, and have spent a lot of time in Israel, both pre and post October 7th. Um, and I'm really looking forward to hearing from our guests today because each of them are really addressing different aspects of mental health and trauma in Israel, which is really, I was thinking it's been a marathon and not a sprint, and will continue to be for a long time. And I was also thinking recently, especially, I've been in a lot of events or some events that are where people are talking a lot about post-trauma, post-trauma, post-trauma. And it really occurs to me that we're not post anything, even almost 3 years after October 7th, we know that in the north is still being berazed by missiles. We know that there's constant fear now of war, and what the ramifications of that is and what that actually means clinically, I'll leave to Gila and to others. But I think we need to maybe realign into this much longer term mindset, because little did we know that we wouldn't be post anything at this point. So that's my reflection, and I want to just introduce quickly our speakers and let you know just the arc of how our time together will go. So I'm really excited to have Gila Tolib join us. Gila is the founder of ICAR, Mental Health Collective. I actually first met with Gila in, I think, November 2023. Gila has a very impressive background from the healthcare management and consulting world. She's formerly with McKinsey and from other and Gila was really the first person who I had an in-depth conversation with about the long-term toll and the long-term needs, challenges, gaps, and opportunities around mental health in Israel. And Gila went on to found this organization that she'll tell you more about, which has been really mapping the field of mental health in Israel, looking at the long, short, mid, and long-term needs and where opportunities are for government, for philanthropy, for advocacy, for resources. So we're going to start the webinar with Gila presenting an overview and a mapping. And then I'm also excited to have two longtime friends here. Yoni Yefet, who is the founder of Kaima Farm, or at yeah, Kaima, or maybe it's just Kaima. I've known Yoni for a very long time. He's an educator and a social, with a background in social work, who 13 years ago, or maybe a little bit more, founded Kaima Farm in Beit Zayit in Jerusalem, working with youth at risk in a very special and unique way, and now has developed a interesting model around mental health recovery and healing. So he'll speak from the field and share a few stories of what he's seeing to kind of put some stories and human face onto what we'll hear from Gila. And Yael Goodman, also a longtime friend who spent some time living here in San Diego. So welcome back to our community virtually, Yael. Yael has a very interesting background. She most recently, I think, really, she was a tour guide and is a tour guide and was doing running tours and has really transformed that knowledge and that ability into a really incredible initiative that uses running as a tool um, to build health of all kinds. And she'll talk about that and also share some stories and some highlights. And then to cap us off, we have Michael Rapkin. Thanks for being here, Michael, the Chief Development Officer at our dear partner organization, the Jewish Federation of San Diego, to tell us a little bit about what they're doing and about a very special philanthropic matching opportunity, thanks to the generosity of Ernest and Evelyn Rady, for gifts to mental health and trauma. So I think with that, I will turn it over to Gila to start us off with an overview and a mapping of the ecosystem and where some of our most compelling opportunities lie.
Thank you. Thank you, Charlene, for this very kind introduction. And hi, everybody. I was going to say good evening, but it's a good morning to you all, I think. And as Charlene mentioned, ICAR, we actually don't take care of any patient, right? We're an organization that's looking at the field at a macro level and trying to understand what are the potential consequences of trauma and what can we do to accelerate recovery. And I wanted to give you an idea of where we are right now in the form of a myth versus reality kind of situation. So first, I want to ground ourselves in a shared baseline because we hear a lot of things. And what I'm going to try to do today is also share some of the key numbers that are shaping the field. And I'm very glad that Yoni and Yael will then give more examples because really my presentation is about population health level. And then we'll hear more stories about individuals afterwards. But just to remind ourselves where we are. The scale of the exposure has been really great. We had 2,000 people killed over the last 2 years, 165,000 people that have been displaced. Some of them still displaced. A lot of people think that it's something in the past. It's not. It's still happening. And when we talk about people going back home in the South, it's not a one-day event. It's a 2 years event. We think that the communities in the South, in Otef Aza, will be back maybe in 2028. So many are going to be displaced for a very long time. 26,000 people have been recognized by the National Insurance, Bituach Leumi, and more than 20,000 soldiers have been injured. And these are, our young people and really the next leaders. So I wanted to start with a little bit of a myth versus reality. Some of the things that we're hearing and, what is actually the reality. So a lot of people are talking about PTSD. PTSD is the core of the mental health crisis. And PTSD matters, but actually it's only one part of the picture. Trauma can show up as depression, as anxiety, as grief. And if we only look at PTSD, we can miss the broader effect of what's happened. For example, we are already seeing 1 in 5 people that are experiencing emotional distress, frequency of continuously. So like Charlene was saying, this is an ongoing situation. This is chronic stress, not only an acute event. Today, we think that about 25% of the population, they're not diagnosed, but when you look at the symptoms, they have probable PTSD, depression, or anxiety. And in the last year, there's been 3.5 million sessions in the public sector of therapy. And that's 42% more than 2022. Now, on the soldier front and reservist, we already have 13,000 new PTSD cases and 9,000 being reviewed. So people that have asked to be recognized, but are still waiting. Just to give you an idea, before the war, there were 4,000 cases being reviewed per year. Right now, we have 3.5 thousand per month being filed, okay? So this is a scale that is unheard of, and the country's trying to catch up. But again, it's not about PTSD only in soldiers, because there's a spillover on their families. Reservists' wives are already saying that 52% recognize deterioration in their children's well-being, and 1 in 3 is considering separation of divorce from their reservist husband or wife. Actually, 50% are thinking about whether they should stay together, but 1/3 is already considering separation of divorce. Now, when you look at trauma beyond PTSD, we understand that people are looking for coping mechanisms, right? And drugs are actually a coping mechanism like any other. Opioids are also something that we need when you've been injured and you lost a limb. But what happens after the trauma passes and the distress is over is that those behaviors are hard to control. So we need to help people find better, healthier coping mechanisms. And same with eating disorders. Eating disorders are very often about gaining control over a situation that seems so chaotic and out of control. And so we're also seeing a lot more of them in the last year. Now, some people know this, some people don't realize the extent to which trauma is impacting physical health. This is much bigger than just mental health. We're talking about mental health, but we've already seen 20% increase in strokes in the south of Israel and 8 times more cardiac events. So mental health, as you guys know, is much more. It's stress, it's anxiety, and that impacts our entire cardiovascular system, that impacts our autoimmune system, and just as even diabetes, but also it can impact even our rates of cancer in the future. All right. Now, what do we hear very often is, oh, everyone in Israel has been exposed to trauma and everybody needs treatment. Now, that is not actually accurate, right? A good system knows how to make the difference between normal stress response, people who say, I'm crying every day. Well, you know what? Maybe that's a great, healthy reaction to what's happening around us. I would be more worried if you didn't feel anything. Between that normal response and when people are actually at clinical risk and when people actually need psychiatric support. And so when we think about where Israel is going, we think it's a 2-track strategy. 15 to 20% of the population already need treatment and care. And we need to make sure that we provide them with the service that they need and the standard of care that they deserve. But actually, 80–85% of the population, us, we're functioning, we're coming to work, we're presenting slides, but really we're kind of on the edge, right? A lot of us are going day by day, and it's unclear how long the population can live like this, let alone flourish and grow. And so for these 80–85% of the population, we really need to think about what prevention, secondary prevention we could do, resilience building we could do, and really think about these as 2 tracks, but both are needed right now. Now, another thing we hear sometimes is, I know that we need to do therapy, but I'm a funder in the US and I can't fix the shortage of mental health professionals. So really, what's my role in supporting mental health? And one very important thing to, reframe is that, yes, therapy is essential, but there's much more that's needed when we have to respond at the national level. For example, for the first track, yes, we need, more mental health professionals, but we also can diversify the care capacity. We can think about different stratified care models where different people, care for the people that are more severely, or the psychologists, get to treat the more severely affected individuals, while maybe peer-to-peer support or groups can help those that have mild depression, mild anxiety. We also need to think about equity and access in the periphery in some populations. And we need to invest in research and innovation, because we know that if we keep pushing people to one-on-one therapy, we will never have enough therapists. And that's why we need to think about effective capacity, stratified care, technology, group, etc. And for the second track, for the people that are still doing okay, we can't wait until we treat them after the crisis, because when we do this, the system will always collapse. We need to think about psychoeducation, normalizing what people are going through, explaining to them that actually their brain is protecting you. It's not broken because you can't sleep. It's actually doing what it's supposed to do. We need to create a trauma-informed society. We need to do more proactive outreach to make sure we detect people in distress early. And that means also building resilience in schools, in workplaces, in communities, so that fewer people are in crisis. And maybe it's obvious for some of you, but just to understand why we talk so much about prevention right now is because really prevention either it reduces demand or it ensures that people get the care that they need when they need it. Then through this, we learn more and we can innovate. And then we have stronger prevention, and all around that frees up resources. It protects people from, it protects our professionals from burnout. And that's how the system can stabilize over time. And that's why we can't wait to treat people. We need to start with prevention. All right. More services means more access. Israel actually has a lot of services. We have many organizations that are doing great work. Actually, let me, just take one example. Here are the organizations that support reservists. I'm not even gonna, pretend you guys can see all these logos, but it's just to give you an idea that today dozens of different organizations are working with reservists in addition to the HMOs, in addition to the Ministry of Defense. And that tells us something very important. It tells us that it's not about a lack of effort right now. It's a lot about a lack of coordination. And not everybody knows how to navigate this field. So success is never going to be one program. Success is going to be that people know where to go, that services know who they are serving, and that the system can learn in real time where people need to be. And so the reality is that services can heal people, but a system will ensure that people reach the services that they need. For a family, for soldiers, for therapists, very often the question is not is there help, but it's which help is right, which is credible, which is available, and which is appropriate for me. And so we need to build that connective tissue that brings together the ecosystem. And to get there, that means we need quality standards, we need to do more triage, navigation, shared measurements, evaluation, and that's how we turn good services into a system. Now, the other myth that I want to talk about is, unfortunately, we're hearing too many people say, okay, we're no longer in an emergency, and the war is coming to an end, which to that I would say amen, because we never know here. And therefore, we don't, mental health is something of the past. And actually, the reality is that when the urgency drops, that's when the symptoms can actually surface and when the healing can start. A lot of people have been holding things together because of the war, because they know they're needed. But now when things actually slow down, that's when the symptoms come. And so what are we expecting? We're expecting, again, that 20% of people will need clinical therapeutic support, not only PTSD, but depression, anxiety. The Army expected 100,000 soldiers injured by 2030, and now they said it's going to be 2028. All the studies point to 20 to 30% increase in suicides after the war is over, when people come home and have a hard time reintegrating. And we also know from recent studies from Social Finance Israel, Natal, that about 200 billion will, it will lead to into 197 billion in direct and indirect costs due to PTSD in just 5 years. We also know that trauma does not always behave like an acute event and then you get better. This is a study from the first responders of 9/11 followed during 20 years. And look, what you could see here is that the symptoms peaked at 9 to 10 years. So things got worse before they got better. And so when people say, how long is this going to be? It's going to take a while. It's going to take a while. And by the way, 9/11 was one day. This has been 2 years, right? So again, we need to make sure that we're preparing for the long run. By the way, the good news from this study that I want us to keep in mind, because I don't like to only give bad news, is that recovery was more dependent on the coping mechanisms and the support that people got after 9/11 than the severity and the extent of the trauma on 9/11, right? Which is really optimistic. It means that we can make a difference in people's life. And so we need to think through how to help people long-term and have multi-year planning. So to summarize a little bit, all of this data and the reality that we face today, I would say that funders have two ways they can support today. And it's not one or the other. Really, Israel needs both. But there's service level funding that, direct services or near direct services where you help people that are in need now. And where you want to identify what are the clear gaps and where do we have models that work. And then there are things that are more systemic. And that means, using the funding to actually help the field work better, to incentivize the field to work better together. And those are investments that usually no single organization can do alone. It's things that require the field to work together. And that's where funders can incentivize people to work with one another. And that's the best way to improve the effective capacity in the entire ecosystem. So let me give you some examples of both. At the service level, for example, some of the gaps that we are seeing are children and teenagers. Today, we are very worried about our teenagers. They've been through COVID, and then, straight into a war that's been 2 years long. And Israel used to be one of the best countries in identifying children at risk. We have great programs. We have in the schools, people who are there. But now we're seeing teenagers get to the hospital after a suicide attempt. And those kids, nobody knew they were struggling because, a lot of them don't really go to school. So the friends didn't see them. And let's be honest, the parents and the teachers, they're going through their own thing. They're also displaced. They're also losing their job or in reserve. And by the way, it's not only the North and the South. A lot of the suicide attempts in the last few weeks have been in Herzliya, in Oda Sharon, in the center of Israel. And so this is really, and some of the violence we've seen, some of you may have heard, right? We're seeing teenagers very aggressive, very impulsive, and this also comes from this emotional dysregulation. There are also areas where we need specialized treatment capacity. I spoke about suicide prevention, but we also need some more family therapy and systems therapy. We need to make sure we have competent care for the different cultures, such as Arab Israelis or Haredim. We need to think about rehabilitation and reintegration. Most of the psychiatrists will be honest enough to say that, if the patient doesn't have a job to go back to or studies to go back to, it doesn't matter what treatment we give them. They need to be able to function. So we need to invest much more in rehabilitation and reintegration. And then lastly, innovative methods. And, I'm not only talking about technology, but even innovative methods like Yoni will talk about around, using nature, using, groups. There's a lot of things we could do, and we need to measure the effectiveness, but that's where funding is required because it's not yet reimbursed all the time. And then at the systemic level, we need more psychoeducation. People need help understanding what's normal, what's not normal, when to seek help, how to support themselves, how to support each other. And that will help reduce stigma and also a necessary demand on clinical care if people know that what they're going through is normal. We need more help with navigation and triage. And there are very few solutions that help people with case management, with matchmaking. But people need to find the right help faster, whether they're soldiers, reservists, spouses. Today, a lot of people call us, and they ask us, where should we go? And sometimes if you don't fit into one category, like you're not a Nova survivor and you're not a reservist, like it's very hard to find where to send those people. Quality standards. Unfortunately, we don't have a lot of quality standards that are regulated in Israel. And so that is also something that the funders can help with by asking to help organizations improve, asking them for outcomes measure, asking them what research they're doing. And that will create a change in the system, but also change efforts to actually help bring quality standards. Like we've been bringing together a lot of nature-based organizations that are together trying to figure out what are the guiding principles that we should use to hold each other accountable for quality. Effective capacity. So that's what I was talking about around, yes, we do not have enough mental health professional, but the system needs also supervised non-clinical roles. We can train peer supporters. We can also train family doctors, community leaders, emotional first aid provider. There are a lot of people around us and everybody should be equipped the same way everybody knows how to put on a tourniquet, right? If someone is bleeding, we should need to know how to talk and support people that are in emotional distress. And then lastly, the field really needs better information about the needs, the services, the outcomes, the gaps. In crisis around the world, there's always public health surveillance where we look at metrics on a regular basis. If it's not daily, then it's monthly. Remember during COVID, we know exactly how many cases there were. We really need to help the system look at this on a real-time basis so we can make decisions based on visibility rather than just on what who asks more or faster. And so again, we need both. We need both services and system, but I would argue that today some of the biggest gaps are because services are not, adding to a system today. That's all I wanted to share. So thank you. And, I'm always here for questions or comments if any of you want to follow up.
Thank you, Gila, for that outstanding mapping. You were very modest, but I will say that ICAR is the best partner and the best platform that I'm aware of, and that many other people would say this for that systems level coordination, mapping, gaps, advocacy. We turn to them, as do many funders, for advice. We've turned to them at every single stage, I think, since we first met in December 2023, about what is the highest and greatest need right now. So to your point of needing both, I really encourage you to, we'll send out after this, the ECAR website is an excellent resource. ECAR puts on an annual, and maybe it's more than annual, I'm not sure, Gila, but like a summit in Israel on mental health that's well attended by a variety of stakeholders, just really, really important. And really the first and one of the few organizations that really looked at this as a whole ecosystem. So thank you. Um, and please do put questions in the chat. I saw there was a question in there that I'll address a little bit later. But I want to just put some human stories on some of the things that Gila brought up, and ask first Yoni Yafed, my friend, to please give a quick background on you and Kaima and maybe how you started, and now how Kaima is evolving into some more focus on mental health, reflected by the war, maybe not even reflected by the war, and some of the other things that you were seeing well before the war, and share a couple stories of people that you're working with that you feel really reflect this, all in 7 minutes or less. You can do it, Yoni.
Yeah, I'll try. Maybe it will be just one story, but I'll start and say thank you very much, first of all, Charlene, for creating this evening and morning. I think it's very important for all of us. And I do want to say that, being there to see ICAR rising up from the beginning. I saw what they do. I think it was one of the most important thing that happened in our field. So I want to thank you, Gila, also. Kaima Farms, today it's farms, started 13 years as a one farm. The first farm in Israel that taking the community supported agriculture and combine it to youth that left school. That was our goal at the beginning. But we knew that using the tool of working together in the field and creating a new environments that we can create in those environments real relationship between human beings will be at the future good for other populations. When October 7 occurred, started, we knew immediately that we will need to open another farm. There were already few farms that were actually spread around the country for youth, but we knew that our next mission will be to create a new farm for people that are suffering from PTSD. Um, One of the things that we understood at the beginning is though that the Ministry of Defense did went pretty fast, I would say, with a bid to open farms across Israel for rehabilitation of people with PTSD. We knew that at the same time there will be lots of people, as Gila just showed us, that will not be recognized as PTSD, mostly because they wouldn't go into the process. So we said that we are going to be the farm that will open ourselves to everyone, to people who are recognized and people that are not recognized. And our tool is pretty much simple, but at the same time complex, and I think very important. And I think it's one of the best tools that we have is to create a farm that we can work together and grow vegetables. Um, Invite those people with PTSD. Of course, they're going through an interview. They tell us their story. But at the farm, we created an environment that the I would say the people around you are coming from the background of trauma and can help you, but without forcing you for therapy. This is also very important because a lot of the people feel that the conventional therapy sometimes is not for them. So it's much more in a natural way. So we work at the field, and then at the end of the day, you can also decide if you want to get into yoga therapy or drama therapy or that other aspect that you can decide by yourself if you want to be. And this is something we're doing for around 3 months for them. And we also, of course, we have of course, we have our how do you say it in English? I just forgot. Um, um,
But
Say
it's
it in Hebrew and maybe somebody can help us
no,
out.
but the problem is that I forgot the Hebrew, so that's the thing.
Oh, can't help you
Um,
there. Okay.
but I'll just skip to the next issue and I'll come back to that. But I do want to tell you about Shachar, and if someone would like, I would also can send the podcast that Shachar is talking because he talks about it, so it's allowed to say. It's just one stories from thousands and thousands of people. Shachar was a commander entering Gaza after October 7, and he was inside the armed vehicle, armed jeep. Um, while they were driving in Gaza, the armed vehicle got a missile, and few of the people inside the armed vehicle died. He's talking about it, and he's saying that um, while he was there at that moment, that's his word. He's saying, I didn't care about the people that died because all I had to care about is the people that are alive because we need to continue and we need to survive. And I'm telling you that because this is one of the common trauma that we see all the time. Gila knows probably also that people are suffering because of their musar, their how do you say it in Gila?
Moral
Their
injury.
moral injury. Thank you. A lot from moral injury, and he's talking about it all the time. He's continuing to say how the moral injury itself was the most difficult thing, and of course he was suffering also from physical. Um, um, Sorry, I just lost my electricity.
Physical trauma.
From
Yoni,
physical trauma, but
can you
yeah.
define maybe a little bit, like quickly, what you mean by moral injury?
So for him, the moment that he didn't care about his friend that was dying captured him. And it stayed here every night and every morning and every time that he's trying to sleep. Why didn't I care about the people that died? My friends, my best friends, like brothers, and I didn't care about them when they died. This is something that I think none of us can imagine how you can live with that. Um, he came to the farm after a year of conventional therapy, and for him, the farm was the most important thing. It's not for everyone, Each, as Gila said, we need to have a lot of different options. But for him, the farm was the thing because he felt that he need to be with other peers that suffered like him. That he need a place that he can touch the soil, that he can feel the sun, that he can feel alive again, and mostly that um, wake up in the morning and being part of something. And I'll send you, of course, if you're interested, the link it's in Hebrew, but probably today with AI and everything, you can translate it. I think it would be very interesting to hear it more.
Thank you, Yoni. Thank you.
Most welcome.
Um, Yael, you come from also a very interesting background, and say a few words and tell us a few stories about who you're working with.
Okay, so I'm excited to be here and honored to meet Gila and be with Yoni. And Michael, it's so nice to see you after so long. And Charlene, thank you for this opportunity. My name is Yael Goodman. I was born and raised in Jerusalem. I've been a tour guide since 1999. I developed a running tour business, and it kind of feels like everything that I've done in life led me to October 7th. In Jerusalem, where I live, we're 80,000 evacuees, and I was trying to think of a way that I can help, that something that's unique and different that only I can give. And I was thinking while I was on a run, I'm like, oh my goodness, people here maybe need to run. Out of these 80,000 evacuees, there must be runners over here. So I just decided to go out there, and I went from hotel to hotel looking for the runners. And the demand was high, and I saw that people really wanted to run because they were runners to begin with. These people came from the Gaza envelope with nothing. They had no shoes, they had no equipment. And so I was like, okay, in order for them to run, they need running shoes, like so basic. So I decided to fundraise. And then it dawned on me that we have a foundation in the family. We have a foundation called the Tani Fund. Tani is my late brother. He died in a tragic accident in 2002. And my family created a foundation in his honor. So I was like, okay, great, let me connect the dots. All my cousins in America are worried. I need running shoes. So I started fundraising. For the first time in my life, I started to fundraise to purchase running shoes and dry fit shirts for the evacuees here in Jerusalem. And slowly, we started creating like groups of over 100 people just running. I was honored to meet a group of religious women from Sderot, like really religious. And when I came to their hotel and said if they want to run, they were like, listen, we never ran, but we're totally into it. So they started running from scratch, and I realized that I have to get them running skirts because they're modest. And I found this person to run them running skirts. So the whole idea was like to build some kind of a common infrastructure to enable them to have this like breathing space. One day I get a phone call from a woman named Chagit. With this angelic voice, she heard that I was doing all these runnings. It was word of mouth in this hotel that this crazy woman in Jerusalem is taking people out for runs. And I'm like, sure. I went to her hotel and I started running with her. And as we were running, she tells me how she survived October 7th. She survived through running. And as we were running, I realized that there was something about running and having the fresh air on our body and feeling our foot touch the ground, and something about not looking at each other, but like running and looking forward, where everything just came out. And I realized it was a very therapeutic space. So after a few months of running a lot with all these evacuees, the people from the OTEF returned back to the OTEF, to the Gaza envelope. And these women of Sderot, who I ran with at least 3 or 4 times a week, I said, why aren't you running? You have shoes, you have skirts, why don't you run? And they're like, because you're not there with us. And I realized that you need to create an anchor. So I said, fine. So I've been driving down to Sderot once a week to continue running with my women from Sderot, who, by the way, are running half marathons today. And then I realized that the demand is going to be high. So then someone told me about this reservist in Jerusalem who has PTSD. And so I'm like, okay, let's open a running group for him. And I did not know where it was going to lead. I had no idea that this would lead to 15 running groups nationwide that exist right now in the Tani Fund. So I didn't realize that I was building an organization as we're going through it. And like you said, Charlene, it's a marathon or the long run. And I love how everything is about running when we talk about this. So we started a group of reservists in Jerusalem, like, okay, we'll throw out a flyer. And the model of buying shoes and giving them shoes to create a very common infrastructure for everyone to have good shoes to put their feet in continues. So like the buying of the shoes still continues. And we have like a partnership with Brooks. So we partnered up with all these different organizations in Israel that want to support what we do. When we started the group of reservists, I sent out a flyer and I found a running trainer. And I said, okay, even if one comes, it will be okay. 45 people signed up within 48 hours. I was like, oh my gosh, what's going on here? What is working over here? A day later, the wives of the reservists were like, what about us? We've been holding down the fort all this time. We need a breathing space too. The next day, I found a running trainer, and all these people I know from my running world. I feel like everything I've done, led me to this position over here. And so that's how we started building multiple running communities. Which really connects with the Tani Fund, because when we built the Tani Fund, the core values of the Tani Fund were volunteering, community, and sports. So it all fit together, how we took the pain of the loss of my brother and harnessed it into building and growth. And this is what it continues to do. So Rachel, I sent you a picture of our running communities. I'm not as technically advanced as some people here, so thank you for this. So there's going to be a picture over here. You can see some of our running groups. On the top, you can see the reservists partners. On the bottom, you can see a group of boys who are 10 to 12 from Sderot, a group in Mitzpe Ramon, and our reservist group down there. So you can see the shape, the size, and the demographic. It really spreads throughout all of Israel. Running therapy has components of therapy, but we don't call it therapy, meaning my coaches are not therapists, but they create a breathing space that has a lot of therapeutic components. Mindfulness, running is about mindfulness. A lot of therapists will tell you, practice mindfulness. Speech therapy component, when you run, the talking is easier. Gila, you were talking about opiates, and when you run, you have like a natural pharmacy inside your body. When you get to a certain point when you run, you release endorphins and different hormones that really help you in the long run to build inner resilience. And community is the key component of this whole thing. So just like Yoni also said, when you meet with a group of people who know what you went through, there's something that you kind of like, as they say to me, you just talk with your eyes. You don't really have to like say anything. You just go together and you get out and run. And we know that our pain, our anxiety, our trauma, our depression is inside our body. And so just to illustrate this, and here's a little movie. Running is just the next movie of the women running. This following movie is our 13th running group of wives of injured. Imagine like how many wives of injured soldiers there are to create a running group in a location in Modi'in. There's like 7 or 8 women. So that's really high amount of people. We have another group of wives of injured soldiers in Kfar Saba. We just recently opened a group of soldiers who identified bodies in Petah Tikva. So like the magnitude, like Gila, when I was seeing your numbers, it really fits with our running groups because I can see the demand and the need. So the example of the video, it doesn't matter if it's not showing up, I can just tell you about it, is these women from Modi'in, they went out for a run And you can see that they're also religious. Here it is. You can see that they're religious. One is wearing a tank top, and they're running in nature. They're wearing shoes that we provided them with. And as they're running, one of them just mentions like the bureaucracy of how hard it is, all the bureaucracy that you need to deal with, like, with getting everything from the state. And then they started getting to a real conversation. So there's something about the run and being out there in nature that really like has all the components that we were all talking about. So how does it work? We reach out to many people. I'm trying to reach out to as many people as possible. That's my fear, that we're not able to reach out to so many people. And using many connections of like Miluim Nikim that I know in different organizations. And what happens, we open a group, I locate a running coach, and 2 months are fully funded by the Tani Fund. So they get to come, they get to know each other, they see if it's something that they want to continue, and 100% of them want to continue. And that's when we buy them shoes, Brooks, and that's when they start paying a loyalty fee, because we believe that if they want to be present, there's some kind of an interaction that has to do to show their commitment, and there's something that has to do with paying a little bit for your healing space. And so we don't need it for the revenue, but we need it for the commitment of the people to keep going and also to feel part of a bigger community. Our last, I have a minute left, I have a timer. So one of the last groups that we have is Kibbutz Nirim. I mean, the story about building running communities in the kibbutzim is amazing. And one of the stories that really entered my heart on October 7th is about baby Kai. He was 9 days old when the terrorists infiltrated his house and burnt it. And when Amy and Uriel, his parents, called, Mada to see what to do, they said, give him some air and put him in the windowsill. So this is baby Kai. And then they called me 5 months ago and asked me to open them a running group. So the next video, I just want to show you like how this is like such growth of these people to want to go back to where they lived, which is like 3 kilometers from Gaza, and building them a running community. So the next video, we're going to see how this is the moment they receive the shoes. It's kind of like a ceremony that we do in the groups. And everyone's getting their Brooks shoes. And at the end, you can see baby Kai, who's 2 years old. So there's Amy, the mom, there's Uriel, the dad, and there's the baby that you saw on the windowsill. So my alarm is ringing, and I gave myself another minute so I know when to stop. So where are we going? We want to build as many running groups as possible. We have Haifa University writing a person writing a doctorate in order to measure what running does, including like MRIs and stuff like that. So I definitely understand there needs to be research and standardization of our running coaches and giving them tools, not to become therapists, but like exactly what you said, Gita, to give them like first aid of how to know how to contain a space. And so now everyone is bleeding. This is what I see now. 2 years in, this is when everyone is falling apart. This is where people are internally bleeding. And so having them collectively in a running group, in a space of healing, really the feedback is immediate. The WhatsApps are really crazy. And so that's what we do. We run forward. And just to end with Hagit, how she saved herself by running from the terrorists. Her life was saved twice from running. And the second time was that she chose to come back to life through running.
Thank you so much, Yael. That's so true. And what I really love about your presentation, besides everything you said, is that it really reminds us that each of us has something that we know how to do pretty well. And there's a need out there, like for that thing. And our challenge, our job, our purpose in life, or in these definitely in times of crisis, is to find the little, it's not just a little thing, but the thing that we know how to do really well, to be determined to find how to do it and then to contribute. And I think that gives each of us agency in a world that has felt so out of control, in a country that's felt so out of control. And just, knowing you over these years, I've also seen how it's uplifted you and really spread, this light and this energy to so many that needed it at that moment, who are now going on, I think, themselves to become coaches and also mentors to others. So thank you so much. It's also a reminder about what happens when we see that the human, when we don't just start thinking of victims and this and that, when we actually see the human needs in the larger picture. So thank you. And Yoni, definitely Kaima is an example of that as well, seeing the human and putting the human in the center of the story and of the situation. So we'll wrap up in a few minutes, but I definitely don't want to miss the opportunity to hear about a very special very, very special giving opportunity. And also any reflections, Michael, the Jewish Federation of San Diego is a strong partner for us, doing a lot of work in the field in Israel, in mental health. And so any reflections you have.
Thanks, Charlene. First, I want to say, as Chief Development Officer for Jewish Federation here in San Diego, I have the opportunity to speak to a lot of donors who are deeply concerned about what's going on in Israel. I'm pleased to see some friends here, Yoni and Yael, who I've had the pleasure of meeting in Israel, and Gila, I hope to meet you one day. And I'll be actually going to Israel in July. I'm looking forward to that. But I hear from a lot of donors really concerned about what's going on and how can they help. There are literally hundreds of programs and initiatives attempting to address this really severe crisis in mental health trauma throughout Israel. And this webinar is a gift, Charlene, because what you are doing and your team are doing are able to help vet and determine what are the right programs. We also have, through our partners at the Jewish Federation of North America, partners on the ground who've helped us vet the most impactful, programs to invest in that are making a real significant difference. Um, and so, core to our mission at Federation is to care for and support vulnerable Jews in need in San Diego and Israel and everywhere around the world. And this is clearly one of the most impacted communities, Jewish communities in the world right now, um, needing our support. And it was in June of last year that Ernest Rady approached us, and Heidi Gantwerk, our CEO, and I met with him. And he said, "I'm really worried, really, really worried about the children of reservists and their families. I'm worried about the mothers and the fathers and the grandparents. I mean, it permeates all of society, all of this war." And of course, we had, Shar HaNegev is a community that we work with very closely. We've had an almost 30-year partnership. It's the hardest hit on October 7th, but the longest war in Israel's history has hit every corner of Israel. And so Ernest said, I want to do something, and I'm going to put up a $5 million challenge match. If you can raise $5 million, I will match dollar for dollar, put towards any efforts that will help with Israel's recovery around mental health support. And it's a true match, meaning that it is not based on pledges, it's based on contributions received, and he is issuing the match in $1 million increments. So since we went public with this in August, well, not public, we started talking to people about it in August. We have $2.8 million in commitments and just over $1 million collected, which meant we triggered the first $1 million match. That said, we do have quite a long way to go. Rachel will put in the chat a brief that details how it is you can support this effort. You can direct, if you make gifts of $25,000 or more, to any one of the programs that you just heard about today, or any of the other programs that have been vetted through JCF or through our partners at JFNA. There are a number of examples listed on the document that Rachel has put in the chat. But if you have a project that you know of, which many of our donors have come to us and said, "This is a project that I've heard of, will you vet it and make sure?" And we have. And so we can actually do that too. The key is that the gifts have to be made to Federation and identified as earmarked for the Rady match. And you will, if you want to use your donor advised fund, you just put it in the memo and you simply say Rady match. And then if there's a particular program or project that you want to support, you just mention that there as well. And we will work with you. There is a nominal, administrative holdback that we have for that to help make sure that we can manage this. It's a very heavy lift, but it's an important one that we are excited to do. Um, and what you're able to do with this is double your impact, and it is a very exciting opportunity. And it's only thanks to the generosity of Ernest and Evelyn Rady, who really saw very early on what this war was doing to Israel. And it is um, uh, we have a short time frame in which to complete the match. All gifts need to come in by July 31st of next year. So if you are interested in, for example, making a pledge in two installments, you can do that. You can make an installment now and do an installment later, as long as the full amount that you want matched comes in by July 31st, 2027. Um, and I'm really excited to see a lot of the projects that Charlene, we've talked about, are getting really urgently needed funding. So thank you for the opportunity to share this.
Thank you so much, Michael. And it really is such an exciting opportunity for us in San Diego. I think this is a really it just gives us an opportunity to really lift also San Diego's ability to make an impact, which is really incredible. And I know we appreciate it so much. We will send a follow-up, both people who are on the webinar and people that weren't able to make it. It will include more information about all of the programs that you heard about, also the Rady Match, some other giving ideas that in the field of mental health. So absolutely, really glad and appreciate the ability to share that. I had one final question, but we don't have time, which was to ask each person what gives them hope. But I'm just going to tell you what gives me hope right now, because why not? And I think from the beginning, it's been the humans in Israel who have carried the burden and carried the opportunity, I guess, of really bringing Israel into a point of not just recovery, but of growth and of taking what Jews do. We take crisis and we turn it into adaptation, transformation, and improving, society. And so I think Gila and Yael and Yoni and many others and Michael are so are such examples of that, of, we're doing more than surviving. We're really building it so that the next generation will have a better future. So I'm very optimistic about Israel, very hopeful about Israel, and it's only because of the people on the call. So thank you so much. Thank you to you who care about Israel, and who want to help partner. The Jewish Community Foundation is always available to help you, to facilitate your giving, and to give you ideas. It's like my favorite thing to do is to talk to people about giving in Israel. So I would personally welcome your calls. So thank you again. Laila Tov to our Israeli friends. Have a good day to our San Diegans, and see you soon.
Laila
Bye.
Tov, thank you.
Thank you. Thank
Goodbye.
you.